Madam Chair, are you ready?
Yes, I am.
All right, I'd like to call to order the Health and Human Services and Aging Committee, little after 1:05
It's 1:08 p.m.
at 1:08. And Madam Clerk, if we can have a roll call, please.
Yes. Good afternoon, everyone. As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell,
Present.
Mr. Sweeney,
Present.
Mr. Castleberry.
Here.
Mr. Hauser,
Here.
Mr. Schlepper.
Here.
You have a quorum.
All right, I just want to say Happy New Year to everyone. I think this is the first HHS committee starting 2026. Is there any public comment, Madam Clerk?
Yes, Lou.
Welcome, Ms. Lou.
Good afternoon, everybody.
Good afternoon.
Well, still welcome to 2026. And for me, I would say something like that, Happy New Year all the way to March, because, you know, the Lunar New Year has been delayed, put it that way. It's coming, but this year it comes later. However, I'm here to give you the follow-up report. When you received my documents last week, the Tuesday, for the county council committee of the whole and the general meeting at that time, not only you were the recipients of that document, also the so-called clients' right officers at YWCA. Guess what? The whole YWCA up to now, nobody has responded. So this proves another point. People supposed to receive services after they pay tax, after they vote. Guess what? When it comes to these services, the first rules has never been carried out. People do not actually have any dignity or respect from any of these situations. So right now, I have to stay at workplaces. Not only I'm still unhoused, now I'm even unsheltered. Does that mean our plan or our funding is going better? No. Since right now, the county jail definitely will be built, bigger, newer, lots of improvement. I will remind you of my New Year resolution I passed for you back in 2018, the first meeting of the year in January at that time. Later, I can provide the video that the New Year resolution was to move homeless services into county jail. In that case, we will not have any lice bugs, any of those. People will get probably a little bit better food. People will have a place to sleep, not like a 32-degree Fahrenheit on the floor. People will not be denied hygiene items, or you're getting the food with a mold on it. Any of these things. These things happen in the shelter system all the time, not only county jail. So for me to be harassed, retaliated for something which I have no control of, pre-existing condition of the facility, where is my justice? And where is the justice for all the people right now stay in that building? Thank you.
Thank you, Ms. Lowe. Is there any further public comment?
That concludes the public comment portion for today's meeting.
All right. Can I have a motion to approve the minutes from our December 3rd, 2025 meeting?
So moved. Second.
Moved by Schlepper, seconded by Castleberry. All in favor, please say aye.
Aye.
All right, we have matter referred to our committee, and then we will have a presentation. Madam Clerk, I did not see anyone in the audience in regards to the ARPA application, but if you could read that into the record.
Yes, we do.
Yes. Resolution 2025-0348, awarding a total sum not to exceed $10,000 to Resource Cleveland for the purpose of funding a new component of the Newcomer Navigators Program from the District 3 ARPA Community Grant Funds.
All right. Can you please come up to the podium? Oh, all right. I apologize. State your name for the record, and just to say, we apologize. It was holiday. This will have to go 3 readings. Every ARPA application goes 3 full readings.
No problem. Good afternoon. Happy 2026. My name is Patrick Kearns, Executive Director of Resource Cleveland. Our organization has been around 16 years. Right now, we are serving annually 4,000 people across Cuyahoga County, all legally arrived, documented immigrants in our county, and our programs go from childhood all the way through family support services. On November 1st, just in Cuyahoga County alone, 4,200 of our immigrant populations here were removed from SNAP. That is a long-term impact. We work closely with Director Gowan and JFS to correct the record, to do some new applications. The number right now of people permanently removed from SNAP in Cuyahoga County is 2,200 to 2,500. Starting immediately on November 1st, our organization partnered with the Greater Cleveland Food Bank. We marshaled support services, we crowdfunded, and we started to deliver to the door of 80 families representing 500 individuals, at least 10 days or 2 weeks worth of food to those families' houses. That includes dried goods that we provide, rice, red beans, cooking oil, laundry detergent, and dish soap, along with what we pick up at the Greater Cleveland Food Bank. This is not a one-to-one fix for SNAP. That is a hole that we cannot quite frankly fill, but it is something that we are doing that is measurably important to these families. We budgeted out for about 6 months of emergency relief. We are now looking at an 8-month trajectory. This is especially true given the fact that our federal government has, to quote, permanently paused green card applications for legally arrived residents, meaning that these folks really right now do not have an opportunity to get reinstalled and reinstated with their SNAP benefits. So we have built out an 8-month program right now. This support from Cuyahoga County Council will go to directly building out our cabinetry, our storage facilities at the office as we are continuing this program on a weekly basis, delivering food to these families. Thank you for having me here today. I am more than happy to answer any questions you might have, and so good to see some very familiar faces and friends again.
All right. Would this assist individuals just on the west side of Cleveland, or how far will this expand?
No, ma'am, this is all the way across Cuyahoga County. We have our delivery routes broken up into 4 routes. So it's west side, east side, including a very large population in the city of East Cleveland that we serve, into Parma, as well as into kind of, let's say, the west-south area as well.
All right. Any questions from my committee? Councilman Sweeney.
Thank you, Madam Chairwoman. Patrick, it's always a pleasure. I think this is needed more now than ever before,
That's correct, yeah.
and I can't thank you. I mean, the way you operate, humble, caring, driven, we're going to get the value of our dollars like nobody else that comes up here, and I'm just very happy that the county can play a very small role. And Madam Chairwoman, I'm going to recommend another 5 go because of the severity of what's happening in his particular world. And if this goes forward, the whole council will decide, and I imagine it's going to go through. So can't stress enough how good a job they do. And if you have any questions on how it could touch your districts, please don't hesitate to call Patrick. He'll be very responsive. Thank you.
Any other questions? Councilman Hauser.
To the chair, to Speaker, I echo Councilman Sweeney's point. I know you mentioned East Cleveland. Can you tell me a little bit more, Patrick, of the work you guys do in the city of East Cleveland?
Absolutely. We actually opened an office there 3 months ago. And we opened that office because we saw that there was a growing population, specifically of newcomers that had moved to East Cleveland, bought houses there, as well as what we refer to kind of in the industry as secondary migrants. So these are folks that have moved from other cities across the country, quite frankly, with the understanding that if you get moved, to the coasts and you arrive in East or West Coast, you're not really going to be able to afford a house in your lifetime. And people saw an opportunity. They've bought houses in East Cleveland. We opened our office, again, I'd say 3 months ago there, to serve this growing population, and we saw this SNAP impact really affect those those families over there. So right now, we are delivering to, in that particular route, 23 families in the city of East Cleveland alone.
That sounds excellent. We appreciate the work you're doing, Patrick. Please add my name as a sponsor as well.
All right, Patrick, how do you, ARPA is one-time dollars. How do you plan on continuing to fund your pantry sites?
Sure. So this is going to go to infrastructure alone. So, when we do the deliveries, we're using tote bins. We need to build out the cabinetry in our basement because we are buying in bulk 20-pound bags of rice, laundry detergent, soap. So this is literally a one-time purchase to turn our office into more of a distribution hub where we can easily load our vehicle. We've been around 16 years, and we have never been a food security organization. We do youth programming, we do sports, we do high school programming, we do college programming. But the situation has now forced us into doing emergency food support because we know that if there's not food at home, families are going to make sacrifices, and young people are not. They're not going to continue on into Tri-C or university. They're going to go right into work. That's not what we want to see happen for the future of our county. So to answer your question, we would build out and hire basically building in cabinetry and storage facilities in our office right now.
And how much is that, how much was that estimate for that total?
That was, I believe that was at $10,000. And so then, if there's additional funding, we are more than happy to come back with a specified line item on that. This does not take into account the transportation costs, one-time costs as well, and insurance. So, the program right now to run for 8 months, we estimate about $85,000. That includes our staff, our transportation time. So this would be a significant help to meet that goal.
Anything else?
We're good. Keep up the good work.
Thank you all. Thanks for having me here today, and happy 2026.
I'd like to make a motion to move forward on 2025-0348.
Second.
All in favor of passing R 2025-0348 to the full council under second reading, please say aye.
Aye.
Please add my name, Madam Clerk.
Madam Clerk, can you add my name as well, please?
Duly noted.
All right. And now we're done with the matters that were referred to this committee. We will now have a presentation. This was something that we tried to get on last year at the end of the year, but budgets and people's schedules kind of precluded us from having it. There was something that ignited this conversation in one of our committees, and I can't remember what it was at this moment, but pregnancy care in the jail. And so we have several speakers that will present today. What's going on in the connection. So unfortunately, this is not something that we like to hear about or to have our women incarcerated that are under this kind of care, but it does happen from occasion, so we would like to be informed as much as we can about it. So, welcome. Please state your names for the record.
Wonderful. Good afternoon. My name is Katie Davis Bellamy. I'm the Chief Operating Officer at Metro Health Community Health Centers, and I support the administration of our contract with the county for correctional medicine.
And my name is Jasmine Long. I'm the President and CEO of Birthing Beautiful Communities.
So thank you to the Chair, Councilwoman Conwell, Vice Chair, Councilman Sweeney, for the opportunity to share about this work. I'm hoping that I can share, and I know, Jasmine, our teams are the ones out doing the work, so we're really excited to share the great work that they do, not only within the justice system, but for as women leave, because I echo you, Councilwoman Conwell, that's not the circumstances anyone would want to be if they're pregnant, to deliver or have their pregnancy care. But really, our goal is how do we provide that compassionate, collaborative care to meet their needs while they're in the justice system, but also as they transition, not just for the mom, but for the baby and that extended family as well. I broke it. There we go. All right, so just as some grounding, although we appreciate all your support of our correctional medicine program, Metro Health has provided care, the comprehensive care since 2019. This slide really just highlights the work that we do on a daily basis for all residents of the Justice Center, which averages anywhere from 1,400 to 1,600 individuals on an annual basis, or a daily basis, I should say. So that's the primary care, the urgent care, it's the intakes, it's the collaboration for care offsite that we do with Chief Rivera and his team on a daily basis to meet those needs. The mental health care and services, the addiction services that I know we presented at prior meetings, the OBGYN services that will go in more depth today. It's the substance use, it's the telemedicine, it's that whole comprehensive care to meet those needs, to make sure that those rights are protected and served in that healthcare capacity. A little bit more specific for the special population of women's health, while we'll talk today about the pregnancy care piece, we do treat women's health as its own area, making sure that some of those special needs that women have are provided there. So we either have family medicine providers or OBGYNs on site to be able to support women throughout that lifespan. So it's their primary care and urgent gynecological care. It's gynecological cancer care if needed, breast health. It is the pregnancy care that will go in more depth. It's menopause care, STD diagnosis and treatment. Again, that whole approach that it's collaborative, it's compassionate, and they're getting the care that they need and answers to questions. One of our key partners in this care, because when those deliveries happen or when individuals are pregnant, or some things happen offsite, whether it's high risk or other needs. And so one of our key partners is obviously Metro Health and our OB program, OBGYN program. So just a little bit to ground you in the services available at Metro Health and especially at our main campus. We are a level 3 comprehensive labor and delivery provider for more than 90 years. We deliver almost 3,000 babies annually. We have high-risk maternal fetal medicine to low-risk midwifery care, so we can really meet the needs of anything that we see within the correctional facility and have the resources, again, on-site or connect to off-site. We're a level 3 neonatal intensive care unit, being able to care for the most high-risk babies if they are born there. We have a new state-of-the-art birthing center with private rooms that if you haven't seen, I'll encourage you, I can introduce you to one of my colleagues who's here to see that space because it's beautiful to support the whole family. We were recognized as a high-performing hospital in 2025, and we also became an accredited baby-friendly hospital this past year. So when we look a little bit more at providing that prenatal care at corrections, I think one of the biggest thing is that collaboration. This is many people trying to meet the needs of the individuals and women that are at the Justice Center. So that is Moms First, the City of Cleaning, it's Birthing Beautiful Communities, it's the Sheriff's Department, it's the county, it's the city. Everyone is this collaborative effort. And so just from an overview on intake, we do conduct pregnancy tests on all reproductive age. We do repeat that pregnancy test. Prenatal care, we collaborate with our food services to make sure they have orders for prenatal vitamins, pregnancy diets as needed. One of the things we'll go more in depth about is a centering programming and doula support that Jasmine will share about. It's not just the care prenatal or the delivery that happens at the hospital, but we also provide postpartum support to our families as well and the moms. I think one of the biggest things that we have is also some enhanced behavioral health support. Some of the things we see is some of our moms not only come in pregnant, but they might also be dealing with mental health, behavioral health issues, and also substance use. So how are we connecting them to those services? We also have community health workers that provide support and resources, not just for the pregnant woman, but for the baby after they're born and for those families that might be caring for that baby if that mom returns to jail after delivering. This just kind of identifies, and I can give you guys bigger copies as well if you don't have it, some of the workflow that our pregnant moms would experience. So when we know they're pregnant, whether it's through that pregnancy test, and sometimes it's the first time they find out they're pregnant, or maybe they come in pregnant as well, we have a dedicated medical assistant who will meet with them to talk to them about the care they need, the care that they've had. They will talk to them about the services that we have right on site, and then that person starts to bring in all the collaborative partners. So they explain the centering pregnancy groups that are available by a provider. They explain the services of Birthing Beautiful Communities, as well as our mental health provider. They talk about what labor and delivery will look like. They talk about the postpartum care. So moms are really cared for throughout that entire journey while they are there. I think one of the other things that is a great collaboration between the health teams, but also the sheriff's department, is there's a lot of advocacy to work with the courts to make sure, does this individual need to be in the Justice Center, or how do we make sure they're in the right place to provide that care? And that's one of the things, as I get to a later slide, we've actually seen a decrease in the number of individuals delivering while they are incarcerated because of that advocacy. So a little bit about centering pregnancy, which is one of the initiatives that we have within and an option for our pregnant moms, is it's group prenatal care. It really allows for that opportunity for participants to meet with other pregnant women to have that experience. Again, this is not where you anticipate or would want to be pregnant, but how are you with other individuals to have that support, to discuss what's going on with your body, to ask questions, to receive one-on-one time with your doctor and have different teaching tools. This is a national program, and there was some funding in 2029 to help modify this to the jail. And so we looked at security considerations. So how can they have journals? How can they have content flexibility? Because we know schedules might change. But they do these group offerings to really support the women. This is really a best practice, and it's often things you don't see in jail. It's definitely things you sometimes see in prison, but not even then. So it's really been an innovative effort, I think, of this collaboration. And there's a lot of benefits. So there's postpartum benefits of educating individuals about contraception after they have the baby, decreases in preterm birth, increased rates of breastfeeding initiation, which we know is both beneficial for the mom, but also for their baby, decreased rates of low birth weight babies. Individuals actually say it's better care because they feel that connection. They are not alone through this process. The visit schedule allows for some flexibility in the jail, even because we're able to work with the moms. Receiving health care leads to greater engagement, learning, and it also shows a decrease in racial disparity in our preterm births. I'm going to pass it on to Jasmine to talk a little bit about the role her team plays within the Justice Center, both there as well as for these moms after the fact.
Okay. Thank you. I think you all have heard a lot from me over the last year. But as you know, we provide doula services to expectant moms. And so in the context of the work that we do at the jail, we started talking about this program actually with Laurel and Sabrina Roberts to see how we would be able to have what was then called the Maternal Mortality Project. And that was the title of the program because it was really centered on how do we ensure that moms in the jail were not passing away and that their babies are also not passing away. But we reframed the program, I think in 2022 or 21 to call it Birthing Moms Unchained, because I think what's important to understand is that when we first started this program, it was still legal to shackle moms while they were giving birth. But because of the collaboration that we had with Warden Frame, with Metro Health, with Birthing Beautiful Communities and Moms First, we were able to get the jail to agree that they would not chain the moms when they were giving birth, but that they would also not have a guard actually be in the room, that they would be able to stand on the outside when moms were giving birth so that they could still have some dignity in their experience. And so that's been really important for us and critical for us in the care. So we're helping them do a birth plan. Again, this may not be a comfortable time for them, but we are helping them understand that they still have autonomy over their birth, that they can have a birth that they choose, and that they can, again, have dignity in their experience. And so really working with the hospital to ensure that we're providing them a good care. We actually for the normal BBC program, we have a 5-part mental health series. For the jail, we have an abridged version that's 3-part called Exhale. And so we're working with the moms around their mental health. Our licensed counselor is actually able to go into the prison and provide sessions with the moms. We have worked very hard to ensure that we can have books, that we can have things for the moms, that we can provide them with extra fruit and vegetables if they so choose. And so, just really trying to ensure that whatever the need of this person is taken care of. And then beyond that, we will continue to work with mom once they are released from the jail, but we will also work with whatever the family is or whoever the family is that takes the baby home. And so sometimes that has been a foster care parent, sometimes it has been a best friend, sometimes it has been a grandparent, and sometimes it has been a partner. And so we will provide support with them up to a year as well. And so that can be diapers, wipes, strollers, car seats, whatever they may need to be able to be in a position to care for that child. We'll provide that for up to a year. And so I think this project is I know this project is very special. It's one of a kind in our state. And we've really been able to have, and as she's going to talk about a little bit later, we've had a powerful impact on the amount of women we've been able to serve, families. And Councilwoman Conwell, when you came to our office, you talked about, just seeing when you visited other jail systems and seeing what they look like. Well, one of the other things I'm very proud of, and we didn't put a picture in here, but we also got them to even revamp what the pregnancy wing looks like in this jail, where it's painted and it looks nice. And again, it just feels like, again, we know that they're in jail, but it still allows for them to have some kind of dignity collaboration, partnership with one another, and be able to breastfeed. We do collect breast milk. If moms choose to breastfeed, they can do that for up to a year there. And so we're helping them to be able to get that milk to whoever has the baby, because we want to still support that and foster that in them. And that still feels like they're connected to their baby. So whatever we can do to make them feel supported, however we can take the load off of the community health workers, the doulas are there. We have about 5 of my staff who are credentialed to go into the jail system, so that we're always able to attend a birth. We're always able to go to a centering pregnancy class, so we're always able to be there when we need to be there to support the individuals who are in the jail. So very grateful for the partnership and collaboration on this. It's a lot of folks who are just doing this work for good. Nobody's looking for a pat on the back or anything like this. We've been working on this program for, at this point, a little over 5 years, and it's been very successful, and I'm very grateful to continue to provide these kind of services to our moms and families in our region.
Thank you. And this just pictures kind of allude to where we have able to store the breast milk.
Ms. Davis, if you could speak directly into the microphone.
Thank you. I apologize. I'm used to walking around, so you're making me stand still. So this is just highlights outside of the centering, whatever options. Again, these are all options for mom, and we want them to have choices. There is routine prenatal care within our regular clinics. We are able to coordinate that high-risk OB at Metro Health. They also can do their delivery and postpartum there, and then we follow any care plan after they are discharged from the hospital. As Jasmine alluded to, is the breastfeeding support, which is just such a great opportunity for them that, you know, this is an example of where we're able to store that. And we also, though, again, it's that collaboration. If we have an issue, what's going on? It's all of the stakeholders coming together monthly to kind of address this. Where else can we be innovative? Where can we try new things? So just some of our high-level outcomes, again, since 2019. So there have been 56 pregnant women who delivered while they're incarcerated. Since 2019 and since implementing some of these different initiatives, we have seen a decrease in preterm deliveries, a decrease in the number of low birth weight babies, an increase in mental health supports, whether it's from Birthing Beautiful Communities or from our mental health team as well, and enhanced postpartum care, really with the doulas, with the CHWs, with everyone being able to follow up with these moms. It's that opportunity to do that. And just kind of, we're looking at some of our year-end data just for some reference. In 2025, we had 129 women who were pregnant and 2 who delivered in 2025, just so you guys have some recent data from last year. So just some other of the outcomes that I think we highlighted, but again, for your guys' record too, we have some of these things written down. As Jasmine alluded to, some patients have that care for nearly a year after delivery. The doula services are available no matter that type of birth. The Moms First community health workers continue to provide that off-site care to families and be that connection. Additionally, our staff make sure that individuals are trained. Not only are the medical staff trained, but how are the correctional staff trained on early warning signs and things to look for to really support pregnant moms. And really, I think at the end, it's this interagency collaboration. And I think I'd just like to end with a story from last year. We had a 34-year-old female who had come into the corrections 6-month pregnant, and our team really did that advocacy. They worked with the Well Project, their parole officer, the corrections staff, and this individual also had some history of addiction, and so we were able to, the individual was released. They went actually to a residential substance use facility that accepted children, and so they were able to stay together, stay connected. So it really is that collaboration. It's treating the mom and helping them meet that needs on whatever that is best for them and their family. So just thank you again to Councilwoman Conwell, Vice Chair Sweeney for the opportunity to share this, and appreciate your guys' time and support.
I wanted to ask a question, Bellamy, because you're connected with Metro, correct?
Correct.
Will this program continue in the new jail site? Is that the plan?
I can't speak to all of that. That would, I think, be the county, and I think that would be obviously a different contract. I would think that based on our experience and the history of the success, I can't see why both the county as well as the Sheriff's Department would not want this to continue.
And that was my second part to that question. Is this a separate contract from the medical jail contract?
So there is additional funding through the City of Cleveland that helps support some of this work, but there are OB services that are already part of our traditional contract.
And how long does mom get to stay with baby after she
So that's going to depend on that course of the delivery and the traditional discharge plan. So it's going to vary from mom to mom.
Okay, so if mom is charged for longer than a year, because I think there was funding I heard from Ms. Long that, you know, we support that outside family. Does DCFS have to step in at that point, or?
It just depends. So if the birthing parent does not have someone to take the child, that is when DCF will step in. And that's when we as an agency have less control over that situation because then it becomes more privatized. However, this program is very unique in that the families tend to want to be connected and they want to provide support. They may not want to connect with the birth mother, and I'll say that, but they may be looking to have resources and support with them, so they will still work with us. Because again, we can't tell the birth mom where baby is in those kind of situations and things such as that, and we may still be providing services for mom as well. So it can be very complex, but again, these situations are so diverse because everyone's situation may be just a little bit different.
Open it up to my committee members. Mr. Hauser?
To the chair, Katie, I know, say Representative Terrence Upchurch was working on some kind of bill at the state level. I haven't been keeping track, but I think it was to report out or a tracking mechanism for the jails. Are you familiar with the bill? Do you know where it's at? And then I think one of the aspects was to report out like miscarriages. Is that something you guys are looking into or already do with this program?
Thank you, and responding through the chair, back to Councilman Hauser. So I am familiar with that. I know some of the last movement was some November. I'm not sure like kind of the current status, some of the last things I had read about that, but it was about some different pregnancy metrics to report out because from the state regulations, there weren't as many around that. We do track a variety of metrics, whether it's the pregnancy data, and obviously because individuals are delivered at Metro, we are able to know some of that miscarriage data. And if there's additional data that the committee would want, I'm happy to provide any additional data on that.
Thank you.
You're welcome.
Councilman Schlepper?
Good afternoon. Thank you both for being here. Can I ask, when you mentioned about mothers being shackled, when was that? I mean, at what point? Was this in the last 10 years? Was this
Yeah, I think through the chair to the councilman, the law did not change until 2021. But through this program, we were not doing that in Cuyahoga County. We stopped that in 2019.
I mean, that's mind-boggling to me when I hear things like that. My whole body went cold when I heard that. I just wanted to say thank you for the work that you're doing. This is, in my opinion, the very center and core of why, you know, these programs are important. The work that you're doing is life-saving. It's changing the game. It's lifting people up. It's all the things that we're supposed to be doing when we're in service to the public. So I'm just deeply, deeply appreciative of all of the efforts that you've made. I had a question in the same vein as, you know, this shackling, which again, that's going to keep me up tonight. Do you have an idea of some of the other restrictions that expectant, I can speak, mothers that are maybe incarcerated are up against, let's say in a hospital setting, as opposed to maybe non-incarcerated mothers? So are there restrictions? You said a guard in the room, those types of things. Do you have an idea of other components that they may be facing and ways that we could maybe relinquish those types of systems?
And I could definitely, so I think the same kind of regulations or policies apply for whatever their restrictions are, or whatever their rules that you would need to follow at the correction facility. So as they transition, we obviously continue to provide the same quality of care, whether you're incarcerated or not. That does not matter at Metro Health. We are there to provide high quality care. And so we defer to the correctional system for any of their standards or regulations and respect those policies.
And to the councilman through the chair, I would also note that because we have these monthly collaborative meetings, if my team goes in and they notice that something is troubling them, they will bring it up. And maybe it's something that can be fixed and maybe it's not because of restriction. But what I will say is we have found that particularly in the last few years that all parties are really willing to work with us to ensure that these moms really have what they need, because the barriers in and of itself is being pregnant and in jail, right? Being isolated, having restrictions placed upon you. And so what are the simple things that we can do? Maybe offer an extra piece of fruit, like those little simple things that may be simple to us, like offering books and knowing like we can bring in books, but they have to be a certain type of book. And so giving them those tools and giving them resources to be able to just have a little bit of human connection, I think relieves some of those barriers. But I will say that truly this is a real collaborative, we see everyone out here, this is a very collaborative effort of folks trying to work together to say, you know, we understand that this is a place of structure and policies and regulations, but what are the things that we might be able to relax, or what are the things that we may be able to give a little space for? Like, again, the guard not being in the room anymore. Like, that is a decision that this team came to together to say we're going to do that, right? And so those little things and being able to advocate for the moms that we're serving, again, you guys hear me say this every time I come to present, it's all about dignity for the moms that we're serving, whether they're a normal client or an incarcerated client. We want to be, and I shouldn't even say that, right? That's wrong framing, right? But to think about how do you just treat these women as individuals who are just pregnant and need somebody to support them.
And through the councilman to the chair, I just would like to add to Jasmine's comment that I do think it's the collaboration. So if we see something, I will say Chief Rivera and his team are definitely open to saying, hey, we hadn't thought about that. Or as long as we're able to go through, it's not going to have a safety risk to anybody, to the mom, to anyone. They're willing to think differently as long as we have those conversations and collaboration.
As a follow-up to that, do we know of any policy in place currently that supports you use the perfect word, a relaxing of these restrictions? Is there something, and maybe again, this is a broader policy question or something that maybe perhaps we can create, but is there a policy in place that would say, if you are an expectant mother and you are incarcerated, the rules change automatically, carte blanche? Obviously, it's at the discretion of, you know, whoever is managing that entire case, but I'd be curious if there was a policy in place to support that.
So we definitely have policies in terms of the overall health care of pregnant women to make sure it is those diets. You are getting those pieces of the puzzle. You have access to all of the things that we talked about. And then I think as we think of these other practices that might need to be innovative, that's when we can update. So our policies are updated on an annual basis and or as needed. And I think it's these conversations like these and the conversations of the issues that we see that help us to change the shackling, change those things with the moms in collaboration with everybody.
I think it's, you know, worth remembering that no matter whether or not somebody has committed a crime, the most important thing is the health of the mother. That supersedes any charge, in my opinion, right? So I think that, you know, if you clear the slate and you focus on that first, and then the status of the mother in terms of, you know, incarcerated or not, I think that's further down the priority list personally. So in any event, thank you for the answers to that. Thank you for the work that you're doing. It's saving lives. And I know personally I'm happy to partner with you in whatever capacity that we can.
Thank you.
Madam Chair. Thank you. Thank you for your presentation today. One thing I did want to ask, I don't know if you said in there in the jail system, how many pregnancies a year, or maybe an average over years would we?
So when we were looking at our year-end data for 2025, we had 129 pregnant women that had come through the justice system, 2 of which delivered.
And so is that, I mean, I don't know if it's really even that relevant, but where do we rank? Do we have a higher number statewide, maybe something like, you know, along those lines?
I can follow up on to get those exact numbers because I don't want to misspeak on average.
It's
but
not,
happy
it's
to.
not that important. I was just kind of curious, you know, this conversation gets you thinking, and that's just a couple things that came to my mind. Councilman Schlepper said about the shackles, that sent a chill. You know, you hear that, and, you know, what I like is your focus on dignity for these patients, and the baby can't choose how they're brought into this world, but for you to start out their life with some dignity, you know, you know, you take away someone's dignity, it's worth everything to them. And it's worth nothing to you. So, you know, you have to honor that, and you let these people deliver with peace. So I appreciate the work you're doing. So thank you.
Thank you, Madam Chairwoman, Madam CEO, Madam
We don't need to add,
COO.
you're adding some other titles.
No, my bad. COO.
Oh, you meant, I
Chief-
apologize.
and-
Yes, we have one. My apologies.
And Chief Executive Officer and President. This is pretty cool how you guys are doing this. And you don't get to hear too often through the chair of the partnership with the jail, with Metro, with Birthing Beautiful, right? So kudos, because things are actually getting done in a cooperative manner and people's thoughts are being understood and executed for the greater good. So that's where I want to start. And just on a side note, Birthing Beautiful, I had no idea who you were when I first started. And you guys, just through you, are just rocking it. From everybody that I talk to on the outside. And every time Birthing Beautiful comes up, it's like, blah, 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 blah. So keep up the great work. And we're not getting sick of seeing you. There's different stages of the pregnancy, right? How does it handle? Does everybody, woman that comes in gets tested?
Everyone who is of reproductive age, yes, would get tested so that we know at your intake. So again, typically, so sometimes individuals may already be pregnant when they come in. Again, the story I closed with, the woman was 6 months pregnant, but there might be that, we might be the first time that we are telling them that they're pregnant. So regardless, we don't make any assumptions. We want to make sure that if someone is pregnant, we are able to help support them, whether or not they knew or not when they came in through intake.
And thank you. And with the different phases of a pregnancy, it's 9 months-ish. And somebody might come in not knowing they're pregnant, and they could have, if they've got a year, they can have the baby and sometimes get discharged, some come in pregnant. So how does that handled in regards to the time that they're there and when they leave if it's not the complete cycle?
So we would make sure that we are really doing that care coordination. So one, we have frequent visits within, whether it's the centering group or within our regular medical care with OB. And so we are making sure that we are educating them throughout the process, that they are aware of the different tests that they need. We also collaborate if someone, say they were to come in at 3 months pregnant, they're having their pregnancy is going as we would plan, but then they're released at 4 months. So we really work in collaboration with Chief Rivera and the corrections team to be able to make sure that they have all the correct paperwork so that they know all of their health history, they know any potential follow-ups, and then in collaboration with whether it's Birthing Beautiful, Moms First, there is that connection as they are released to be connected to that care that they need, whether they want to continue with a Metro provider or that provider of choice as they transition out. But I think that really that opportunity is the Birthing Beautiful communities. It's the Moms First that are able to do that follow-up care, again, whether they are in custody or out of custody.
And thank you. I got two more, I think. When I saw mental health, right, because this, I think that's the most important thing in regards to dealing with something that is added to what their reality is in regards to whatever's occurring besides the pregnancy. I don't think it's mental health, it's just comfort or getting them through this moment. And I see through the presentation, there's some of that, right? Because when I saw mental health, it's more of a, dealing with whatever issues they may have, but the folks that have a strong mental health capacity still needs something, and I imagine it emulates through the process. Can you just talk about that very briefly?
Yeah, responding through the chair to the councilman. So I think Jasmine definitely alluded to the great mental health program they've had and the opportunity for their counselor to come in and do, I believe you said the 3 sessions that are able to collaborate. So that's specifically for those moms. And then we additionally not only have, we have a mental health counselor on our team that's able to see individuals both in the group setting as well as one-on-one, specifically for moms who are pregnant. And then we obviously have other broader, both mental health and addiction services that if that mom has other mental health supports outside of just being pregnant. That's a lot that going on and a lot of change in and of itself, but they have other complex needs. They can see other people on our mental health team as well and have that coordinated care.
And thank you. I'm just going to keep, the mental health is sometimes a negative stereotype. Sometimes they just need your arm put around them and say it's going to be okay. And that's going to go a long way.
Through the councilman, through the chair, I mean, imagine you come into the jail, you don't know you're pregnant, you're told that you're pregnant there, you're not prepared to even navigate a pregnancy, you're in the jail. And that's what the doula does, right? To provide that support to them to say like, hey, we're gonna help you get through this process. Hey, we're gonna see if there's somebody in your family who will take the baby. Process and navigate with you through, hey, the child may be going to DCF, but what can we do, right? Like really helping someone to be able to navigate a very personally challenging moment in time for them and what that looks like for them. Because again, the dynamics of family can be interesting. Maybe your mom takes your baby home, but then mom isn't calling you. So you don't feel like you're talking to the baby enough. You don't feel like you know what's going on with your child. So there's a lot of emotions that are happening, and now you're still incarcerated without your child. And so to your point, a lot of our work as doulas is to be that we are support persons. We're there to provide whatever kind of help that they may need. And it can be mental health in the way that we traditionally think about mental health, but it can also be mental health and just being a support system, which is why it is nice that they have the pregnancy pods, and the centering is incredible because they get to bond with the individuals who are in that group with them. And so they're not going through this alone. They have partners, they have the hospital staff, they have their doulas, they have the community health workers, and then they have one another as well to lean on. So it is, you're getting it, like it's just can be very traumatic. And so how do you help a person process through this?
Thank you, and it's good when I get it finally. And through the chair, just a shout out to Chief Rivera and our sheriff, right? The sheriff's department, there's discussions about them here and there, but this is a shining example of how this sheriff's department is run. And your testimony today is something that is not even music to my ears, it's what we expect and what we get. So just, take my time to give a shout out to them. So, Madam Chairwoman, thank you for letting me go on my diatribe. I think I owe you a few minutes, but hopefully it'll be all right.
We're good. Just one final question from me. After the birth, is mom re-handcuffed? Their time in the hospital?
I believe, and Chief, you can speak. I'm going to speak to the transpire.
And I know this is not delivery, but I'm just saying there.
Good afternoon, everyone. Nestor Rivera, Chief of Corrections. I've been listening, and so we do have a heart here in Cuyahoga, and so we're not going to shackle you. We're not going to treat you any less than what you deserve. So if there's a reason that we need to restrain you, we would. There's a Ohio Revised Code that speaks specifically to pregnant females and what you can and can't do. I think it's 2901.10. It's pretty specific. So 99.9% of the time we are going to do what the doctor requests. So if that's waiting in the hallway, we wait in the hallway. If it's removing cuffs, whatever the request is, we try to comply. No questions asked.
And typically, how long does a female stay on average after having given birth? And I know there may be some complications with some cases, but on average.
So it could be anywhere from 2 to 3 days, kind of just depending on the time of delivery. And again, if it was a vaginal birth or a C-section or obviously other complications may change that. And I think echoing the chief, there's obviously that opportunity where if that mom is choosing for that bonding and breastfeeding, their team works with us to make sure that mom can have that connection, can do that breastfeeding so that they can have that bonding time.
And how do we deal with at the jail that psychological part that the mom goes through once she's separated from the baby? How are you managing that?
Do you want both of us to answer?
So we are still at BBC, and they still have access to the hospital at White, but we are also still providing services. We're allowed to still continue to provide them with services into the postpartum. And some of them are coming home as well, and so then we are going to continue to provide services for them as they are home. We can do visits with these individuals as well. So we're trying to stay connected with them in the postpartum, and they're still receiving their care. So they still have access to Metro, they still have access to the community health workers, and there's still this coordination piece that allows for them to have some support.
When you speak of home, Jasmine, you talk about their home or back at, okay.
And I think the other thing I would just add is that some of those support groups, so from our mental health, those continue postpartum as if the mom wants to, because we definitely recognize there are a lot of hormones, there are a lot of different pieces that are going on. So they have that support of that same group if those individuals are still there, or the one-on-one counseling as well. They have pictures of their baby. So while that's not the same thing, what are those things, again, that we can have that dignity, have that sense of connection for that mom? But I think it is that continued support and that acknowledgement that they can see a counselor on a daily basis to address any of those needs.
And the hard question would be, if that baby doesn't make it, what resources are we giving that mom when she has to return back to incarceration and she doesn't have the picture, right? Or she could have the picture, but it's not the picture she wants. Are we beefed up enough? Metro have individuals to assist with that.
Yeah, we would have the same, whether obviously that would be devastating, and we would want them to have that support to make sure that they have, whether it's different counseling, whether it's different screenings, to really make sure that they are supported and have the right resources and collaborate with corrections as well to make sure everyone is aware, and how do we monitor, support this mom through that transition and that loss that no one would want to have.
Because I know most hospitals have that grief group, right, for moms that have that. Is there any way that they could join in telepathically or whatever?
Yeah, I think that's a really, and I will say at least in this past year, I mean, and you obviously hope it never happens. We have not had that experience, but I really appreciate that suggestion because I do think with the use of technology, where can we leverage that and the other partnerships and resources that exist for these moms to give them that other resources. So definitely a great idea and something to bring to our stakeholders meeting.
Bring it to the next one because it can happen, and the mom is the one that suffers if we're not prepared and planned. Any other further questions from my colleagues? Anything else you ladies would like to share? I actually went on a tour to go over and see the unit, so it is nice, and as nice as it can be. So we thank you both for. Now, Michael Hauser did jar my memory. Yes, that is what spurred when State Rep Upchurch brought out the legislation he was pushing for downstate, and that got us to thinking like, wow, what do we do here in the county? So thank you for reminding me, Mike. I know it was a reason why we wanted to do this. Better late than never, and thank you, ladies, for coming out.
Thank you so much.
All right, any miscellaneous business? Meeting's adjourned.